Hi, I'm Dr. Chris Tomshack, CEO of HealthSource, America's Chiropractor. Doctors, this one's for you. Have you ever sat down to create a treatment program for a brand new patient and you know what, you're just not positive how long it's going to take to get them out of pain and ultimately to maximum functional improvement? Certainly. Or perhaps maybe you focus purely on getting them out of pain with no emphasis on functional improvement, and that's your prerogative as long as that's your patient's prerogative. This is a big decision to make. Now, for instance, is your patient more interested in simply getting out of pain, or would they rather shoot for getting as much functional improvement as is possible given their current condition? Did you ask them what their goal is? How do you respond to either choice? Do you know how to accurately, and this is a big one, and objectively measure functional improvement so that you have intra-examiner reliability? I mean, let's face it, our patients have the right to choose the type of outcomes that they desire. It's their body, not what we want to force them into, right? So maybe we should be asking each patient that comes in our office what their healthcare goals are as a result of seeking care from us. The truth is that most chiropractors don't ever ask these types of questions for a plethora of reasons. And of course, most commonly is a non-reproducible method of measuring functional progress. This can cause costs, if you will, your practice serious reputation damage if your patients wanted maximum functional improvement so they can do what they love at the level they want to do it. And instead, they only receive pain relief care. And when the pain returns, as it often does, they're left disappointed. That's when you hear, hey, I tried chiropractic in the past, worked for a while, but the pain came back. And who among us hasn't heard that way too many times, perhaps ad nauseum? On the flip side, if your patient merely wanted pain relief and you told them they must have functional improvement, they'll simply vote with their feet and leave the office entirely. Nobody wins there. So either way, if you don't know what your patient wants, everyone stands to lose. First your patient, and then, of course, your practice. The name of the game is to find out what kind of care your patients want, and then deliver it with state-of-the-art care, period. The critical key is to recommend or prescribe only what the patient needs and nothing else. It's their body and it's their choice as to what they want to receive. But if they don't know that there are options, how are they supposed to make the right choice for them according to their values? Keeping it simple and recommending only what the patient needs is a great way to practice. Carefully explain the differences between pain relief care and maximal functional improvement, and then approximately what it takes to get there is practicing with full transparency. Making sure you have an objective way to measure functional improvement is also extremely important as well. But that's fodder for another discussion. Hope you found value. Have a fantastic and healthy day. Thanks for watching. And if you found this information helpful or interesting or both, well then please like and follow me on Facebook, check us out on Insta and LinkedIn as well. And while you're at it, cruise on over to healthsourcefranchise.com and we'll see you there. Take care.